Today I'll be talking about vitamin A, but before we start, I'd like to just give a brief overview of the general characteristics of fat-soluble vitamins. They're dissolvable in organic solvents. They're stored in the body tissues in greater quantities than water-soluble vitamins. They are stored in adipose tissue. They're more likely to lead to toxicity than the water-soluble vitamins, and the amount stored varies quite widely. They're absorbed to a greater degree when fat is consumed in the diet with them. And if you have a disease or a fat malabsorption issue, that can lead to deficiency. And as I said, they're transported with fat by lipoproteins. So vitamin A, there's two general classifications that I'm going to talk about in terms of vitamin A. There's the retinol or the preformed A, and that's the most active form of the vitamin that we find in animal foods. And then there's the beta-carotene, which is a provitamin or precursor form. And it's one of the few carotenoids that the body can convert to retinol, to the active form. Dietary sources I've divided into two categories, one of the preformed vitamin A and then of the provitamin A. So the preformed vitamin A, again, primarily comes from animal sources: beef, chicken, liver, whole milk, eggs, cod and halibut liver oils, fortified cereals, and then beta-carotene, the rich and colorful orange and green vegetables such as spinach and sweet potato and squash. Vitamin A requires digestion before absorption, so even if you cook your food sources thoroughly, there's still going to be some enzymatic digestion that's going to need to occur before it's absorbed. If you eat a meal that has 10 grams of fat or more, you're likely to absorb 70 to 90% of the vitamin A. In terms of carotenoid absorption, it does vary depending on the food processing. In terms of digestion and absorption, both the retinoids and carotenoids are to some extent metabolized in the small intestine cells, the enterocytes. The retinol has to be esterified and then incorporated in chylomicrons to be transported. And then those chylomicrons deliver the retinol esters, again, they've been esterified, and some unesterified retinol and the carotenoids to extrahepatic tissues, so those tissues outside of the liver. There's some metabolism that occurs in the liver, and that retinol that was esterified and transported by the chylomicron may be stored in the liver, in the stellate cells and the parenchymal cells. And it's transported in the blood primarily by two carrier proteins, retinol binding protein, we also refer to as RBP, and transthyretin. And the carotenoids are transported as part of lipoproteins, and they are stored both in the liver and the adipose tissue. In terms of excretion, it depends on the intake, and it is found both in urine and feces. There's a small amount that's excreted or expired, I should say, from the lungs. The carotenoids can be metabolized into several different compounds that are excreted in the bile, and some of the metabolites of vitamin A are returned to the liver through enterohepatic circulation, and that helps to conserve stores of vitamin A. In terms of function, it promotes vision and prevents night blindness, promotes growth, prevents drying of the skin and eyes. Xerophthalmia is a disease of the eye often seen in children in third world countries. It promotes immune function and resistance to bacterial infection, prevents cardiovascular disease, or is thought to. There's some question of whether or not it plays a role in cancer prevention, and the medications used for acne, such as Accutane and retinoic acid, are derivatives of vitamin A. It will interfere with some other fat-soluble vitamins if taken in excess, including vitamin K, which interferes with vitamin K and therefore causes problems with clotting, or can potentially cause problems with clotting. High beta-carotene intake may lower your vitamin E concentrations in the plasma. Protein and zinc influence vitamin A status and transport, and iron metabolism is also linked with both the carotenoids and vitamin A. Deficiency, the epithelial cells end up producing too much keratin, and that's of course found in the hair and the nails and the outermost layers of the skin, and you get a rough and bumpy look to the skin. And as I was mentioning before, let me see if I can fix this for you. The excess of keratin can result in something called xerophthalmia, or dry eye, and it can lead to blindness. Large intakes of preformed vitamin A, so the retinol, not the beta-carotene, over a long period of time can cause toxicity. In terms of toxicity, use of Accutane and Retin-A can be teratogenic, meaning if you're taking Accutane, I believe they even make you come in for a pregnancy test monthly because it causes such profound birth defects. Signs and symptoms of toxicity: bone, muscle pain, decreased appetite, headache, dry skin, hair loss, hepatomegaly, vomiting. Again, it's teratogenic. You certainly would not want to be using Retin-A, which is the brand name of retinoic acid, or Accutane if you were trying to become pregnant or you were pregnant. And there is possibility of permanent damage from vitamin A toxicity. In order to assess nutriture, sometimes eye examinations are done, obviously by a qualified individual. Dietitians aren't doing those. Plasma retinol concentrations can be evaluated, and then there's some relative dose response tests that can be done as well. In terms of the RDA, I've listed those for you. In the past, vitamin A had been discussed in terms, I guess I could say, of international units and retinol equivalents. It's no longer used or discussed in that manner in terms of reference range. I mean dietary allowance, I'm sorry, I'm thinking of labs. The tolerable upper level intake is 3,000 micrograms of RAE, and that again can lead to, above that, hypervitaminosis A, and it has teratogenic effects. Beta-carotene can cause hyperkeratinosis, but it doesn't cause permanent damage. And what ends up happening is you look like a carrot, or you look like you've had a bad spray tan, I guess I should say. You actually have an orange hue or color to the skin. I had a friend who fed her daughter excessively carrots and squash, and the child literally turned that orange kind of yellow color. It was harmless. It didn't look great, but it was harmless. And it's not advised to take excess vitamin A in the diet. It is in some of the multivitamin mineral supplements, but I would not take vitamin A alone. And that concludes my discussion of vitamin A. Let me know if you have any questions. Thank you.